Hi, I'm Siddhika Panjwani. I'm a clinical neuropsychologist working in the field of epilepsy assessment since the last 16 years. Over a period of years, we realized that a lot of our children with epilepsy also had traits of autistic spectrum disorder. And as we gave them the ketogenic diet, over a period of time, they started showing an improvement in the autistic spectrum traits, and also they had behavioral problems. There are three cardinal features of autism. The first is there is either a delay in language development, or then the child develops normal language till 2 or 3 years of age, and then there is a regression of the language milestone. So the child starts losing the language milestones. The other cardinal feature of autism is problems in social interaction. So if this child has difficulties in verbal communication, non-verbal communication, so the child wouldn't give adequate eye contact, would not respond to affection or emotions, would not respond to being called, or if would not give any facial gestures, or would not pull their hands in front to hug the parent. They have difficulty with age appropriate peer relationships, so they can't mingle with children, they don't have a concept of group play. And the third is they have issues which are we call stereotypical behaviors. So they would either flap their hands or start jumping when they are happy, or they would rock their bodies continuously, or be fascinated by a certain object like a car or a wheel of a car or a certain revolving toy, which comes across as odd to the parents. There is no pharmacological intervention for autism spectrum disorder. So probably there are some common neuropathological pathways, and we found a substantial improvement predominantly in areas of motor function, where they started having better fine motor skills, they started having a better pencil hold, their writing ability improved, there was more communication, verbal and non-verbal. So the child who just had echolalia, like who just repeat what the parents told the child, or who would just use language to express demands, started talking in small sentences. So instead of water, she would say, I want water. So that kind of a shift in language we started seeing. Plus the child started showing a desire to mingle with other children. Although she's still away from getting the concept of group play, but she's at least initiating the idea that I want to go and play with other children. I want to share my toys with other children. Behavioral issues like biting behavior, hitting behavior have decreased to a marked degree. Also, from a school perspective, the teachers are reporting that the child is focusing better in class, responding more in class. She's picking up concepts of colors, shapes, alphabets. So, when we use an objective assessment to assess autism, which we say CARS, the Childhood Autism Rating Scale. And on the scale, a child with a CARS score of 40 has come to a CARS score of 28 after the diet for 6 months actually. So within 6 months, we are seeing a significant shift in the child's ability to perform at school, perform socially, and also a decrease in the autism spectrum disorder, which makes us feel that this diet does hold some water in these autism spectrum disorders.